functioning and independent in our own home. And I think all of us up here have seen patients who have had to transition to different arrangements because of their balance or fear of falling, things like that. It's really important. The more you do now, the better. It's just like anything. So some things that you can do to really prepare your home, we've already mentioned, but I'm just going to highlight them again because it might not, you maybe didn't hear it the first time. So you want to pick up those throw rugs, especially if you're using a walker. I know they make our house nice and pretty, but they are a huge tripping hazard, especially with a walker. You want to make sure that in the house, if you don't like to wear your shoes in the house, that you have good house slippers that maybe have a back, not ones that sag down. Those, again, tend to trip you up. Things to do, like Jordan mentioned, remove extension cords, phone cords, things like that, that again, all it takes is for your toe to get in there. Those are things that you can't, if your foot gets caught in a cord, you're probably going to fall. You know, you hope you can catch yourself a bit or the best that you can, but these are things that you guys can do to just make it where that event doesn't happen in your home. You also want to make sure that you have adequate lighting, especially at night. That's when we tend to have people fall the most. They get up to go to the bathroom. Just put a nightlight in there. They come on automatically when it turns dark. Keep that path well lit and clear so that you have easy access to the restroom or to the kitchen, wherever it is that you tend to head to in the evening. And then you always want to make sure that if you have liquids or something like that on your floor, that you clean them up right away as they happen. Don't say, oh, I'll get that later, because oftentimes people forget, and all it takes, again, is for your foot to hit that, and then you might hit the ground, and we don't want that. Head to the next slide. So we we've said this a lot, but the main thing is to stay as active as possible. In order to stay active, like Jordan said, you can't be afraid of falling. You have to feel like you can do that activity and do it well. That's what keeps you involved in it, right? You also want to make sure that you do have the correct medication list. And I know we kind of have said that over and over, but that's really important. Oftentimes, when you have those drug-to-drug interactions, if you're not talking to your physician about your signs and your symptoms, they don't know. They're not mind readers. And a lot of times I have patients come to me and they go, oh, I've been dizzy ever since I started taking this, but I haven't told anybody. Well, your physician needs to know those things. That's really important. You also want to make sure you have your vision and hearing checked regularly. That kind of makes sense now, knowing that your balance system is made up. These are two of the three components. If your vision is changing and you're not seeing an eye doctor and you're not getting your glasses advanced, then you're probably going to have problems with your balance. Same thing with your hearing. If you have trouble with your inner ear and you're not getting that assessed, you're probably, again, going to have trouble with your balance. And then, again, you want to correct those home safety hazards. Make life safe and easy for you to function and be safe at home so that you can stay there and be as independent as possible for as long as possible. So what we'd like to do today, we know that maybe not all of you will want it, but we'd like to provide a free balance assessment.